Well, earlier I spoke to two mothers, Sammie McFarland, whose 14-year-old daughter has had COVID and is still unwell. She's the founder of Long COVID Kids, a group of parents who are worried about long-term impact of the virus on their children and believe schools aren't safe to reopen. And to Molly Kingsley, who's a co-founder of the group Us for Them, which is campaigning for schools to reopen as quickly as possible. Molly Kingsley, how swiftly, in your view, should schools be reopened?
I mean, I think schools have already gone to a lot of work in putting together, very sensible, respectful hygiene measures. I think we would like to see them open now as soon as possible, or we would like to see an assessment of the harm that keeping them closed is causing.
Well, what is, in your view, the harm that keeping them closed is causing or risks causing?
I think it's threefold. I think the first harm that a lot of people have been focused on is, the educational disparity that is, I think an educational gap is now a chasm, and that seems to be widening almost by the day. I think for many parents, actually, that's almost becoming a less of a concern. I think many of us are becoming very worried about the mental health impacts. And I think also there are physical harms, actually. So there was a very worrying report last week out from China, a big report in China suggesting there's a link between, excessive screen time and lockdown and deteriorating eyesight. There's similar concerns about posture. There's obviously huge concerns about increasing obesity. So I think, I think there are a range of harms, some of them potentially long lasting to children.
Sammie McFarland, does any of that persuade you that really schools need to open ASAP?
I think when we're talking about opening schools in a pandemic with a virus that we don't yet understand, we need to be thinking a bit beyond eyesight and posture, and we need to be thinking about the children who have got organ damage, who are having seizures, who have been paralysed by this, by contracting COVID. And we've got children that have, most of the children who were ill right back in March are not yet showing signs of getting better. And worse than that, many are declining without support. And for me, it's an absolutely, it's not even a question. Opening the schools at this point in time would be insane.
And you've had COVID yourself and your daughter is still ill, right?
That's correct. We were both ill in March and unfortunately spent nearly 8 months on pretty much essentially a bed rest, both fit and active and healthy before, and we're still not better. She hasn't been able to go back to school. She hasn't been able to resume normal activity, and she still is waiting to be seen by a consultant and get some answers.
Molly Kingsley?
Look, I mean, Sammie, that's heartbreaking, and I'm really sorry to hear that, of course. I think what I would say to that is the proportion of children in particular that are at risk of serious illness from COVID, and I appreciate you have been very unlucky, is very, very, very small. It is a tiny percentage of the people who are at threat from this virus, whereas school shutdowns are jeopardizing the lives of millions of children.
Our concern is that there is no understanding of this virus, and we don't know what the long-term effects are going to be.
I mean, I would use that line to support exactly the opposite argument, actually, which is we know so little about what we are doing by closing schools. I was looking at a figure this morning that said 1 in 4 children, 1 in 4 young people now say they are unable to cope with life. What does the long-term consequence of that look like?
And Sammie, would you accept that hard evidence that the children in your group are suffering these very debilitating symptoms because of COVID, that evidence is hard to come by, isn't it?
Not in all cases. So in the original cohort of people that were ill back in early March, April time, or you couldn't get tested if you weren't hospitalised. So they've got clinical diagnosis in some cases, not in all cases, because not all doctors will give clinical diagnosis. That's still very much a battle that we're trying to win. It's now much more accepted in the adults, but for children, it's a little bit more challenging.
Molly, Us for Them is backed by quite a few anti-lockdown Conservative MPs. Is there a sense that this is less of a sort of grassroots movement than a political campaign, which has quite a libertarian streak?
It certainly wasn't until a few days ago. I mean, look, obviously we're aware of the press. We are very much a grassroots campaign.
Have you been hijacked, though?
I don't think we've been hijacked. No, I think it so happens, and I think it's really unfortunate that this debate has fallen on such party lines. I do not understand it, and I wish people from all sides of the political spectrum would reach out and get on board, because, you know, I do not see myself as political. I don't think I don't even know who my co-founders voted for, and I don't want to know. So for us, this has always been about the welfare of children.
What would you say is the toll taken on your family and other families you know by not being at school and by lockdown persisting?
Look, I mean, I will freely admit I'm one of the lucky ones. My kids are, you know, two of the lucky ones. The school has been really, really trying, and the quality of learning is as good as can be expected, but it's still just not the same. And I think, as I said at the beginning, you know, I'm becoming quite concerned about the length of time. They're 4 and 7, they're young, the length of time without seeing or interacting with friends. And actually, you know, listening to all of this, to me, it just reinforces the need to kind of put differences aside and, you know, find a solution that means that kids do have social interaction and education that isn't just being plonked in front of a laptop, because I think we're all agreeing that that is just not working for so many kids.
Molly, it sounds like Sammie might have changed your mind a bit.
I don't think, no, I think we should get schools back, and I think we should get schools back, you know, with sensible and proportionate hygiene measures, and that's what we've said all along.
I do agree with Molly that it would be great to see a collaborative approach on how we could get kids back to school, but I would be interested to ask Molly what she feels would be the appropriate measures to enable that to happen.
Sure. I mean, look, I think there's been a lot of work, obviously, that's gone into making schools COVID safe, and I think from the very beginning that, you know, most of the measures that Department for Education have proposed seem eminently sensible. So more spacing, hand washing, you know, catch it, kill it, bin it, all those things make very good sense.
Molly Kingsley and Sammie McFarland, thank you both very much for joining us.